Chairman, thank you. Dr. Meyer, let me start. Excuse me. Let me start with you. In your written testimony, you advocate for an approach that balances quality measures. You go on to write that the large number of measures, quote, threatens to shift resources from improving quality in areas of greatest need to cover a plethora of measures that may have limited impact on veterans. And that captures my attention because surely we ought to be focused on the things that have the greatest level of consequence. Can you explain how the VA should balance measures to make certain areas with the greatest needs are at the forefront? Which measurements do you feel are more important to veterans than the civilian population?
Yeah. First of all, I would begin by saying that this is a challenge in the civilian sector and, for the VA. And the reality is that we've gotten very good at collecting information, at least in some organizations, and particularly with the VA, with its electronic systems. With that said, that can lead to what I would call measurement distraction. And what I would advocate for is for the VA to really be quite focused on something important in each of those domains, in safety, effectiveness, efficiency, veteran-centeredness, equity, and timeliness, but not to have 15 measures in each, to have 2 or 3. In addition, one of the things that we heard consistently over the course of the testimony this afternoon is the importance of focusing on leadership. And the VA has been a leader in collecting information on safety, culture, and engagement of its employees. And I think in both of those areas, that is very important quality and safety data that's not surfaced in many of the current benchmarks that people follow. And so I would suggest focusing on fewer measures in each of those domains, making sure that we're paying attention to culture, which has a direct reflection on leadership, and finally, ensuring that we're looking that we have an engaged and safe workforce.
Thank you for your devotion to this topic in this hearing. Dr. Perlin, good to see you again. I'm interested in hearing about the 4-cause survey process as it pertains to VHA facilities. What are some examples of events that could trigger a 4-cause survey?
Thank you, Mr. Ranking Member. The 4-cause survey will occur if there are allegations of something that's quite egregious, if there are a cluster of complaints, or frankly, if there is, as I mentioned, a sentinel event, something that either resulted in death or could have had the potential of death or permanent harm. The Joint Commission will come in and go very deep to look at a particular system. Since it's come up a number of times, let's tackle the issue of Clarksburg. Joint Commission learned about Clarksburg in August of 2019, well after the events occurred. Had the Joint Commission learned at an earlier point, we would have come in and helped to conduct a root cause analysis to understand what some of the contributing factors were in terms of the lapses that led to the hiring of the individual. But we consider it then a best practice not to wait for a media event, not to wait for complaints, but at the moment a failure is recognized or the risk of a serious failure, to call the Joint Commission and have our experts go through the root cause analysis to understand what the failure modes were, and most importantly, to build robust defenses so those modes won't happen again. This is a matter of policy, by the way, in the Department of Defense. Thanks.
Has the Joint Commission ever performed a 4-cause survey to a VHA facility as a result of an OIG report or a patient safety concern? And have any of those facilities or programs lost accreditation as a result of failing that survey?
Well, I'm 2 months into the role and don't know the specific genesis of any of the 4-cause surveys. My understanding is that Joint Commission over the past decade has conducted about 10% of its surveys as 4-cause surveys or special surveys. That would be about 29 surveys.
Maybe you could follow up if...
Be happy to provide that information.
Thank you very much.
Thank you.
In 43 seconds, Mr. Missel, I have always admired your work, and I appreciate your presence here today. I think you and your office are hugely important to this committee, and more importantly, hugely important to the veterans that the Department of Veterans Affairs serves. While conducting a particular review, let me give a little background in the few seconds I have. Mr. Missel, your office recently published a report, Purchases of Smartphones and Tablets for Veterans, use during COVID-19 pandemic. This report and that review found that the VHA, through the Office of Connected Care officials, incurred approximately $2.3 million in wasted taxpayer funds for purchased iPhones and iPads that remained in storage with activated data plans instead of being sent directly to intended veterans. While conducting this review, did your office look specifically into any quality of care issues that occurred within this specific program? For example, did veterans who resided in rural or highly rural areas of the country experience more quality of care issues due to lack of connectivity than their urban counterparts?
Well, first, Senator Moran, thank you so much for your words. The answer to the question is we did not look at quality of care in that project. What we were looking at was the cost of the smartphones and the iPads for veterans experiencing homelessness. However, we have looked at connectivity issue in several other work products. In one of them, we did find serious issues given that VA was doing more and more telehealth work in rural areas. And in July of 2020, as the pandemic is really starting and VA announced that they were going to be moving more and more towards telehealth, what we did is we looked at 16 highly rural CBOCs that were having connectivity issues to see whether or not there'd be adequate community care resources available to them. And what we found in 12 of the 16, they did not have the kind of community care services that you would hope for in these highly rural areas.
Thank you for your answer.